Postnatal mental health difficulties or challenges affect many parents. A number of factors can contribute to this, including hormonal changes, sleep deprivation and stress. Autistic parents are more likely to experience postnatal mental health difficulties. This is because autistic people may be more likely to experience sensory overload, anxiety, depression and trauma. It doesn't mean that as an autistic person you will experience postnatal mental health difficulties. The drop and change in hormones after 3 or 4 weeks can also have a huge impact on mental health. This is a very high risk time to develop perinatal mental illness. Autistic people may be more sensitive to hormonal changes. This can lead to a number of issues including depression, anxiety and mood swings. Mental health issues can be challenging to spot in yourself. If you are able, it can be worth having a conversation with anyone trustworthy in your support network before your baby is born. If you have experienced mental health issues before, what did they look like? What did it feel like internally? What helped and what didn't? If you haven't experienced mental health issues before, you may want to talk to your support network about how they can communicate concerns with you. Trauma or dissociation can be a risk for people after birth. They can be caused by a number of factors such as traumatic birth experience, the physical and emotional changes that happen during pregnancy and birth, as well as the stress and overwhelm of caring for a new baby. They can manifest in different ways, such as reliving or avoiding thoughts about the trauma and feeling detached or disconnected from your body and your surroundings. If you are experiencing trauma after birth, please reach out for support. Talk to your midwife, health visitor or GP, or access peer support from a charity or local group that is understanding of autistic experiences, such as Autistic Parents UK. Some people choose to debrief their traumatic experience with a private midwife rather than the NHS midwife. Some private midwives have specific additional training in helping to process trauma. There is support available, and you don't have to go through this alone. There are significant differences between autistic shutdown, burnout and depression, as well as the difference between postnatal illness and birth blues. Burnout and depression are two different concerns and are supported in different ways. Please see Ruth's video. Baby blues is a hormonal response and often leads to short-term depressive feelings that can occur after childbirth and usually alleviates within a few weeks. If you experience more serious mental health concerns such as intrusive thoughts or suicidal ideation, talking it through with an experienced person you trust can help to break down and process what you are experiencing. It is crucial to express it to other people to prevent assumptions and jumping to conclusions. People often feel overwhelmed and want the feeling to stop. Autistic people may more likely to experience feelings of overwhelm and anxiety. This can lead to a desire to run away from the situation. There is a difference between I just want it to stop and I'm planning to make it stop. It is often useful to discuss this with your family or friends or supporters antenatally so you can assert your needs and make sure that you are getting the care that you need